Hello, my name is John Salvucci. I'm with the law firm Lewis Brisbois, and thanks to ChiroSecure, I have an opportunity to speak with you today. And the topic is generally aimed toward a better understanding of the causes of vertebral artery dissection and stroke and the long-held association between cervical manipulative therapy and those events. To begin, I want to start with a topic that may seem unrelated, specifically the famous physician Galen, who, in addition to being the physician for Marcus Aurelius, was also a physician to the gladiators. And Galen, in 200 AD, dictated the anatomy and physiology which governed medicine and science for 1,500 years. And among his theories was that we digest food and that is translated by the liver into blood, and that the blood circulates and dissipates in the system. Well, in 1628, William Harvey, was an Englishman physician, was doing a study of the hearts in small animals and the volume of blood going through the heart. And he wrote a book as a result of his research. And in the 14th chapter of the book, he wrote, "Perhaps the blood circulates in the body." Well, as a result of that statement, which went contrary to Galen, everyone concluded that he was crazy and he lost all of his patients. About 30 years later, an Italian physician, Malpighi, discovered capillaries, the connection between the arterial and venous systems, proving that Harvey was correct. The point of the story is that medicine and science often takes positions and holds them for decades and for centuries before they are corrected. And we are in the midst of what I believe to be an error that will not end in our lifetimes. Namely, the leap from an association between cervical manipulative therapy and arterial dissections and strokes. The leap being that association as believed to be causative. So let's begin with what occurs and why I contend that this represents a mistake among many physicians, emergency room doctors, and neurologists. So once again, the topic, vertebral artery dissection, the risks and realities of related ischemic stroke. As we all know and appreciate, the vertebral arteries supply blood to the posterior brain. And the supply is provided by a right and left vertebral artery, although only the right is shown in this diagram. They rise up through the cervical foramen, come together to join the basilar artery, and they deliver 20% of the blood flow to the brain is delivered by the vertebral arteries. The arteries themselves, all arteries, consist of three layers: an intima, the innermost layer, a media, the middle layer, and an adventitia. When there is a tear of the intima, an intimal tear, the tear of the innermost lining of the artery, that is called a dissection. And when that occurs, the body responds to seal off that the blood flow from going where it should not go. And an analogy that I commonly use is scraping your knee on the sidewalk. Your blood begins to flow out of your body, a place where it should not go, and fibrin and platelets accumulate there to form a thrombus to prevent the blood from going where it should not go. That thrombus heals the intima, the tissue, and over time, it dissolves. And as it dissolves, emboli may fall from the thrombus, travel downstream, and cause what we call a thromboembolic ischemic stroke, the blockage of blood flow to the brain as a result of the emboli traveling downstream. And a stroke is defined as the death of brain cells. So you have this blockage, cessation of flow, and the death of brain cells. Now, we can start with the basics in terms of three general areas of medicine and science that negate the assumption, common assumption, that the association between cervical manipulative therapy and thromboembolic ischemic stroke is causative. We begin with a very simple principle, biomechanical. The question raised is, what force is necessary before the artery fails, that the strain on the artery causes a failure? This study was performed by a group led by Professor Herzog, and indeed for the last 25 to 30 years, his group has issued numerous publications in support of his original findings. And those findings biomechanically conclude that it takes 6 to 9 times more force than can be exerted during cervical manipulative therapy in order to generate a failure of the artery or a tear in that intima. So just based purely on biomechanics, it's not possible. In addition to the straightforward biomechanical argument, we have support in the literature that discusses the nature of general blunt trauma instigating an arterial dissection. And by that, I mean, generally speaking, arterial dissections can be divided into two categories: blunt trauma and what we call spontaneous. Now, blunt trauma typically involves forces from the outside generated through the tissues of the neck with sufficient force to cause a dissection of the artery. And in blunt trauma cases, you typically have damage to bony structures and always damage to the surrounding tissues, ligaments, and tendons. So why is this an important finding? Because in those cases in which cervical manipulative therapy has been alleged to have caused a dissection and thereby triggered an ischemic stroke, those imaging studies to this day, in all the cases I've reviewed, fail to demonstrate any damage to the tissues surrounding the artery, which negate the theory that an outside force, namely the cervical manipulation, generates enough force and has caused that tear in the intima. In addition, to switch topics again in regard to the support for this position, the defense position, we have the body of work performed epidemiologically. And as we know, case reports, the weakest form of evidence, are what is always referred to by those who want to connect causatively the manipulation and the ischemic stroke. They cite the association. The patient was at a chiropractor, 2 days later suffered a stroke. There must be causation. Well, we know, as I mentioned, that case reports are the weakest form of evidence, and the strongest form is epidemiologic studies. And we've had the key study performed by Professor Cassidy, who took the Canadian population, those with neck pain and headache, the foremost clinical features of a vertebral artery dissection. He took that collection of people and divided them into those who went to chiropractors and those who went to their primary care physicians. And the hypothesis was straightforward. If the chiropractic therapy were causing dissections and subsequent strokes, you would expect to see a higher rate or incidence of ischemic strokes in the population who addressed their neck pain and headache by going to a chiropractor. And what he found was that the numbers were essentially identical. Fortunately, the same study was done on a U.S. population, using a U.S. population by Kozlov. And it's not a surprise that his results were essentially identical to those of Professor Cassidy. In addition, there is a separate analysis to support our defense position, and that is the mere timeline. When you scrape your knee on a sidewalk, the scab doesn't form and fall off within hours or minutes or even a day or so. It takes time. Likewise, the literature has supported a typical timeline from arterial dissection to ischemic stroke, namely 7 to 14 days. So there's a tear in the intima, which generates neck pain and headache. That leads the patient to a chiropractor for therapy. Then subsequently, if the unfortunate small rare occurrence of an ischemic stroke is to follow, then subsequently, and in some cases after the chiropractic therapy, the stroke occurs. But the timeline doesn't begin when the therapy occurs, but rather when the neck pain and headache originate. And in those cases where intuitively you would feel would be the weakest cases, namely the cases where there is an event within minutes or hours after the therapy, you would think those would be the most difficult cases conceptually to defend because of the temporal connection. Indeed, sometimes from our position, they offer an advantage, namely that this evolution from a dissection to the thrombus formation to the weakening of the thrombus and dissolving of it is not something that takes place within minutes or hours. I've touched upon generally some of the main arguments that address the allegation that cervical manipulation can cause a dissection and an ischemic stroke. I haven't touched on all of them. Each case provides its own unique set of facts and information. Often we see conditions that help us explain why the dissection occurred, whether it be a postpartum condition of the plaintiff or a connective tissue disorder or a series of risk factors that we've identified in the literature that are likewise associated with spontaneous arterial dissections. This information goes along to support those main pillars that I provided moments ago. I want to thank you for your attention. I hope this has been informative. And once again, I want to thank Dr. Hoffman and ChiroSecure for providing me this opportunity to address you today.